Hey guys, so I want to come in. My phone's on 1%. Don't make no sense. So I gotta charge it. Hold on. It died as soon as I got up. Okay, so y'all know I've been trying to get this video out. The story time about how we lost our first son. And I wanted my husband to be in the video as well, but we've been doing so much lately. Like we've been, he been coming out home, be outside working and all that kind of stuff. So I want to go ahead and get it out there because I got some other stuff that I want to come and upload. So I guess I'll start by, and if you're new to my channel, go ahead and subscribe so you can follow along on my TTC journey. Anyway, so I guess I'll start by, let's see, because I think in the last video, I shared my overall journey from start to finish. So, let's see, roughly in about 2013, I did Clomid. I forgot how many rounds I did of that, but it never did work. So I think it was early, sometime into 2014, I switched to letrozole, went to RE, and I switched to letrozole, and I believe it worked on the first try, first or second. Yeah, my memory has gotten bad since having kids. So like some stuff I don't remember, but I remember it, but like, the fine details. Anyway, so I got pregnant on letrozole, and this was roughly, because I was due in March, so September, October, November, December, January, February, no, August, June, July, August, September, October, November, December, January, February, March. Okay, June. Yeah. Around that time, I was going to the RE, once per week, I believe. And once I graduated there at 9 weeks, I went to back to my OB, and we'll just call her Dr. H. So, got to her, and we were doing just the regular, I wasn't high risk at the time because I had never had a miscarriage. I've never, had ectopic or had to go through anything else. So, we just regular pregnancy. So, around, let's see, I think 19, had to be like 19 or 20 weeks. It was around in December by this point. We went down to stay with my parents, and just because my husband wanted to go hunting and all that kind of stuff. So we were down there, and I think we were down there just like every weekend. And so we would, go back and forth. So come probably the beginning of January, and I never told anyone the specifics of what happened, but so my husband had asked me. He was like, we were at home by this point, before we were getting ready to go back down to my parents. So he was like, he wanted to have intercourse. So at this point, that particular day, I was just like, no, I just don't feel like it. I really don't want to. But me being a wife, I'm trying to do what, I'm supposed to do. So we did it anyway. So we left and went to my parents' house. So we got down there, and I went to use the bathroom, and when I wiped, it's like I felt something tugging, and I pulled the tissue, and it was like a long, thick glob, and it was red. So at this, at this point, this is my first pregnancy. I'm not gonna say I don't know much, but I wasn't really just, I was used to discharge. I knew, you could bleed and all that kind of stuff and stuff like that. So I didn't pay it no mind. I just, it kind of puzzled me, but so I'm thinking to myself, and I kind of got a little slight cramping. So I didn't, I was like, okay, whatever. So then I think I sat there and I can't remember if it was that time. Like, I don't know if some extra fluid came out and I thought I was just peeing again. I'm like, well, dang, I had to pee some more. So I got up, came out, and I sat on the couch because, I was kind of cramping just a tad bit, but, it wasn't out of the ordinary or whatever. So days go by, we're, doing the usual, hanging out, going, he's going hunting and going back home, blah, 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 day-to-day activities. So as the days go by, I start to notice, like, as I walk, if I strain, if I, use any kind of force to do anything, is like I'm peeing on myself. And at the time, I didn't, it started out small. So I thought I was peeing because sometimes my bladder does get weak. So I was just like, what is going on? So this went on, I know, for a good week maybe. So by this point, about 21 weeks. So it was getting more and more like everything I do. When I'm in the bed at night, if I turn over, it's like a quick gush, and it was never running down my leg, never anything. It was just as if my bladder was weak, and that's what I thought it was, because that's all it felt like. So and it used to didn't go through my clothes, just maybe like my underwear, but not through like my whole clothes. So eventually it started getting more and more. So I'm like, okay. Then around this time, the church that we were going to, they go to the nursing homes on certain days and do like a service with them. So I had went one night. I think my husband had to work, so I went one night with them, and I had on some regular sweatpants or something like that, and I had rode with my mom, or my husband dropped me out there. I can't remember, whatever the case may be. So while we were there, I was just trying to sit still, because at this point I was used to it. So I was like, okay, I can't make too many movements. And then if I get up, somebody might see that it's on my clothes, because at this point I know it's on my clothes. So like, I would be embarrassed to get up, but I couldn't take it anymore, because it was like, as I was just sitting there, it was just coming out and I wasn't even moving. So I'm like, okay, I know something is wrong at this point. So anytime the baby would move certain ways, then it would just like, he would like unplug something and it would just go shh, shh. So I got up and I tried to sneak to the bathroom without anybody noticing my pants. So I went to the bathroom, and like my clothes were just wet. Like I had peed myself, and it wasn't all the way down, because it was just in the crotch area, but it was just very wet. So we get done with the service or whatever, and I stayed in there a good bit, and I tried to get some tissue and just tuck it, tuck. So I'm like, oh my gosh, I don't know what to do. So we get in the car and we're headed home, and I'm still puzzled. Like I'm shocked. I don't know what's going on. And it didn't even cross my mind that it could be fluid, because everybody says, if your water breaks, it's gonna be a big gush. It's gonna go down your leg, blah blah blah. And I wish people would stop saying that. So I tell my mom, I'm like, okay, I build the courage to say, I said, Mom, I've been leaking fluids. I don't know what's going on, like every time I move. And she was like, well, do you need to go to the doctor? I said, I don't know. So she was like, well, at least call them and see what they say. So I called the doctor, the nurse on triage, because it was late at night. And she tells me to come in to be checked. So we turn around, or did we drop my sister off at home? I don't know. We ended up going back out to the hospital that night, and we had to been around because they got through it, the nursing home, I think around 8ish. So we probably got to the hospital probably about 9 something or 10. So we get there and they do the FN some kind of test. I'll try to put it somewhere. So they do the test to check to see if it's amniotic fluid, and sure enough, it was. So my mom's up there with me, and she's calling, my husband and my dad and things like that, and saying, they're gonna keep me at least, overnight to see what's going on. So the next day, and this is where it kind of gets blurry because you probably understand why, but so the next day is when I officially get to talk to a doctor, and I believe a doctor did come in the night before. As a matter of fact, they did. They did come in the night before and told me, that's who told me it was amniotic fluid and that I would have to, stay. So then my doctor, Dr. H, comes in the next day or so and, goes into further detail and says, this is what's happening. You're pretty much, your water has broken. They did an ultrasound and things like that. And there was only like a pocket of fluid, just enough like around his face there where he could, would be okay. Like it was always just one small pocket. And it was under the what it is. They call it, let me look it up. But, so after doing the medical term, amniotic, I should have did all this before I got on here. Poly is a lot. I forget how they say it. Let me turn this off. Okay, oligohydramnios. So that's what it was. Y'all know, listen. I had low amniotic fluid. It was below the recommended level for them to diagnose that. Anyway, so she told me that they were gonna keep me. I had the baby. I was listening for the baby. So yeah, so she ended up telling me that I had to stay. They were gonna admit me, and I had to stay until I was at least 34 weeks, and she would induce me at 34 weeks. So at the time, I was only 20, maybe I think 22 weeks by this time, 22. And that's below, that's under the amount of weeks they consider viable. So they were also trying to, determine a lot of factors. They were like, if I was to deliver, then we wouldn't be able to stay there. They would have to airlift baby to another hospital, the big hospital that has everything to care for him if he were to come that early. So they were just going through a whole bunch of stuff with me, and they wanted me to try to get his weight up because he was on the smaller side for the amount of weeks that I was at. So they were telling me to do this, do that, try to do this and do that. So I got admitted January 20th, 2015. So days go by, and I'm just in my room. Like, she would not at first she wanted me on bed rest the entire time. That means I cannot get out of my bed, I can't walk, I can't even use a bedside pan. So a few days go by, and I'm just like, I can't do this. It's hard trying to get up on a bedpan because I have to strain to get up on a bedpan, and me straining is pushing more fluid out. So I'm like, if I do that, I might as well just let me just step out and sit right here on the bedside pan, you know. So she kind of fought me for a while, and the nurses, they fought for me, and she ended up allowing me to do so. So I'm like, okay, I graduated from the bed to be able to use the bedside pan. So got used to that, and I'm like, okay, I'm going stir crazy. I can't just stay here. You know, I go walk to the window. She didn't want me to walk to my window. Y'all, my window was not even 10 feet. I don't think it was 10 feet away. If it was right at 10 feet. So yeah, so my husband, you know, we're moving everything, you know, most of our stuff. He brought in the game system. We brought in our own refrigerator, our own snacks, all of that. So, because we were prepared to stay. I mean, we were basically living there. So the nurses, they would come in every day, sit with me, and do, you know, do everything. They're like family to me. And I really appreciate them for being there for me. So, another few weeks go by, another couple of weeks, probably about 1 or 2 weeks, you know, 2, 3. You know, my doctor, she came in every day around noonish, which is when she was going for lunch. She would come in and check the baby monitor, look at the paper report that it prints out, ask me if I had any problems. And I kid y'all not, 99% of the time I said no. I can probably count on one hand, on half of a hand, how many times I had to tell her about something. So, even like the head nurse, like she would come in my room, and normally the head nurse is the one that's in charge of everything on the floor, which means they are busy. Now, if the head nurse had time to come in my room and chit chat, that means I was not a bad patient. That she would always tell me, like, you're the easiest patient I have on the floor, the easiest. So, you know, I didn't complain about anything. It got to the point where I was doing everything for myself. I had to go to the bathroom. I would unhook the machines. I would come back. I would hook it up. The lady that came in to do my temperature checks and blood pressure checks, like, they handed me the stuff. It was like, here you go. I was doing all of this myself every day. So, I mean, it was nothing to me. So, come March the 3rd, well, back it up. In between that time, I had a urinary tract infection when I got there. And then I had a urinary tract infection sometime in between, you know, in the mid-stay. And both of those, which I caught, I told them I'm having such and such kind of pain, which I usually have. It's not the typical, but I usually have this pain. And I know I probably have a urinary tract infection. They tested me. Boom. I got a urinary tract infection. They gave me my antibiotics, and we're good. So March 3rd came, and I started having like this discharge. And it was like flesh almost. Tissues. It was like that. And it was like a green, a deep forestry green. Excuse me. Almost like a green, black, brownish color. So I was, you know, taking pictures, and I showed it to my nurse, and I was like, do you know what this is? And she was like, I have no idea what this is. So she took it. She gave me a cup to put it in. She took it and showed all of the other nurses, because it looked concerning. And it was like a long piece, and it was like, just, you know, weird. And it's like, I started to feel like I could feel pieces ripping from my insides. Because I told my doctor, I said, well, I feel like something is ripping, like behind my belly button all the way down. Like, I feel like stuff is ripping from me. And eventually, that's when, like March the 3rd, that's when it finally came out or whatever. So, yeah, the nurse showed it around. No one knew what it was. So she brought it back. She was like, okay, well, oh, my legs sleep. She was like, well, ask Dr. H to see if, you know, she'll send it out for a coach. What did she say? A pathology. send it to the pathology lab. So the next day she came in and I gave it to her and I sent it to her and I told her, you know, can she get it tested? Or if she knew what it was. So she said these exact words, y'all. I kid y'all not. She looked at it. She said, I'm not sure what this is. But normally I would send it to the pathology lab, but I'm not going to send it because I'm not sure, you know, what it is. And so I'm just looking like, you're not going to send it because you don't know what it is? Like, isn't that more reason to send it? Just because I wasn't complaining about anything prior to, like, I've been the easiest patient you possibly could have ever had. You want to say that you don't want to send this? So I'm like, okay, so, I mean, what am I supposed to do, you know? So I ended up telling some of the nurses what she said. And I think they were trying to push for her to go ahead and send it. And she would not. So one of the other doctors, I can't remember. I don't know if one of the other doctors ended up sending it for me or they ended up talking to her and getting it sent off. I don't know what happened with that. I really don't remember because shortly after that, I started feeling symptoms of another urinary tract infection. So I go to tell her another, like a day or so after that. Until I said, well, I'm having this certain pain again that I've been having whenever I get a urinary tract infection. Could you test me for urinary tract infection so I can get something? So she says, what are you having? You know, what kind of pains are you having? And I go to tell her it's like a burning pain kind of below my belly button, down low. And so she says, well, that's not the typical signs of a urinary tract infection, so I'm not going to test you. I'm like, what do you mean? You're not going to, y'all, by this point, I was so stir crazy from being there. By this point, I had been in there 7 weeks. 7 weeks in my room. She did not allow me out. I went out 2 times because a nurse had to fight for me to put me in a wheelchair and they rolled me around the hospital floors. And I went outside maybe once or twice. And then the last time I went outside was March the 8th because it was the day before I went into labor. So, I was stir crazy. Y'all, I had been in a small room and the only other place I went was upstairs when I would get my ultrasounds. So I had been in one room for 7 weeks. 7 weeks in the bed doing nothing. She would not let me go home because she said it was a risk for getting an infection. Clearly, it was more of a risk being in the hospital. Like I could have been at home comfortable in my own space, not having to be stressed. So when she told me that about the urinary tract infection, the test, I was just at this point, I wanted to blow up. I wanted to explode. And to avoid me having to do that, I didn't say anything. And I know I should have I know I should have said something. And so I eventually did. I ended up texting my mom because I was so pissed at this point. And I told her, I said, well, next time she come in here, I'm going to have to tell her because this don't make no sense. So the next time she came in, which was, I think that incident was like the March the 4th or the 5th, maybe the 6th. Somewhere in there, but after that. So, no, it was the 6th. So I told her the next day, I said, listen, if I tell you something is wrong with me, now you know I have never complained. Never complained. I don't complain. And for me to tell you something and you don't listen, I said that cannot happen. I said, I'm not telling you something just to be telling you. Like, I know my own body. And even weeks before that, I had asked her, something just was bothering me. Something told me. I asked her, I said, if I wanted you to deliver me before 34 weeks, would you? She said, no. And I just left it at that. Because this was before all the problems occurred. So I'm like, okay, you know, maybe I'm just rushing because I want my baby to be here. But I now know, because I have a strong intuition about things, I now know there's a reason why I asked for this. And maybe if this would have happened, then we wouldn't have lost our baby. So yeah, after I told her, you know, about listening to me when I tell her something, I think something went on and she had to leave or what else. Can't remember. But that was like the 6th. So now, mind you, I have a urinary tract infection. So March the 8th comes, and one of the nurses is Nurse B is on shift that night, and I started having some discharge. And so I told her, I said, I think my mucus plug just came out. And she says, no, was it Nurse B or the other one? One of them. She was like, no, that's not your mucus plug. You're fine. You're not going to do anything. You're okay. That's